I can't help but be a bit more optimistic than usual with this process. First, because the location, I was, like I said earlier, time was the right one, Accra. And like you mentioned earlier, this is after uncapping the National Health Insurance Fund. We're still across the continent struggling with universal health coverage and having national health insurance schemes. And I think it's fair to say that on our continent, when we're looking at better examples, we can think Rwanda, we can think Ghana. Obviously, Ghana's trying to increase the depth of coverage, and going in that direction with uncapping, it definitely makes sense. So about that uncapping, perhaps if you can, I guess, break down for us what that means now for your authority and agency, and what that will mean for Ghanaians now that you have access to, you mentioned about 3.2 billion Ghana cedis extra.
So the uncapping has actually revolutionized the work that we're doing because it's brought in, much more funding. But more importantly, what it means is that, as you rightly said, we have 56% of Ghanaians, or last year we had 56% of Ghanaians on the National Health Insurance Scheme. This year we are pushing to go to 60%. So it means that we can pay health providers more rapidly than we used to do. It means that this can give the health facilities the funding they need to provide the services that they've been providing to Ghanaians. But then there's even something more interesting, and I think it was mentioned earlier. What the president of Ghana has also done is to introduce two things. One is the Mahama Cares, because if you look at Ghana, fully 40% and a little more of our all-cause mortality is now coming from non-communicable diseases. So the National Health Insurance Scheme, when it was birthed over 20 years ago, was focused mainly on curative and also on communicable diseases. But we're trying to change. So some of this money is going into this Mahama Cares, which is looking at strokes, renal failure, cardiac events, cancers, and so on, and making sure that we can cover this, because this actually causes even a higher financial burden on people, And I think what the evidence is showing us is that when Ghanaians have, if somebody in the family has one of these adverse events, maximum a year, there's some kind of penury. So there's a serious effect on the family. So that's one side. Then, of course, I think Dr. Ngozi mentioned earlier about free primary healthcare, where we're also looking at having free primary healthcare, a basic minimal package of health services based on diagnostics, based on vaccination, based on promoting health. So what we're trying to say is that we're giving end-to-end coverage for healthcare. And we hope that as we catch more and more of the diseases through the preventive and the diagnostics and the vaccines, we would be reducing the burden eventually on the other end. Not a lot more diseases will be going right through to end-stage renal failures and stage 4 cancers and so on. But this has all been made possible because there's much more funding that we can apply to this. And the president is very committed. The Minister of Finance, Minister of Health, they check in with us every day to make sure we have our funding, that we are paying, the health facilities, and that Mahama Cares was launched a few weeks ago. The free primary healthcare will be launched a few weeks to come. We're hoping that in the next 6 months to 1 year, end-to-end coverage will be in effect.
Yeah, and with that extra money comes a lot of financial responsibility. I'd be remiss if we didn't highlight that. I think your agency, the NHIA, has already paid about 50% of the monies required. But interestingly, there was a report of your services going after those who are making fraudulent claims. That's something that in our parts of the world is even just as damaging, if not more damaging, than the actual depth of coverage. So can you maybe touch on that?
So, you are spot on. We are not only looking at the quantum of resources, we're looking at the efficiency of the use. Because, as you rightly said, we have a significant challenge with two things. One is fraudulent claims. And the other is, despite the fact that we are now paying health facilities more readily and more rapidly, there's a certain culture of out-of-pocket payments that was begun when facilities were not being paid quickly enough. And it has stayed where there's double dipping. So the facilities get paid by the National Health Insurance Authority and yet still charge the patients. And we're trying to stamp these out. You may have noticed that a certain hospital in the last couple of days was cited for some of these irregularities. And we are clothed with the legislation to actually call these out, and to deal with it. And we're going to make sure that we deal with it, so that the monies are used in the most efficient way possible. And I must tell you also that my bosses check in with me very regularly and with my executive management. Number one, to make sure that the money is being used properly. And number two, to make sure that all these checking on the health facilities and so on is going on and reports are coming out regularly to make sure that we're on track.